Massachusetts should have a better system in allocating how many nurses per patient.
All of us nurses to transport these signatures to the Secretary of State's office so we can get these 2 questions on the ballot in 2014.
Been ratified. This has not been voted on by the nurses. This has been put upon us by Bay State.
After 28 months of negotiations, still no deal, and unionized nurses will go out on strike again.
Unionized nurses here at Bay State Franklin Medical Center in Greenfield will give their notice tomorrow, and they will hold their one-day strike.
Strike has been prevented in Franklin County. Unionized Greenfield nurses and Bay State health officials held a joint news briefing in Northampton Friday night.
None of us wanted to go out on strike, but we had to do this in order to get us back to the table so we could get it resolved.
My recent longitudinal analysis of registered nurse staffing in Massachusetts hospitals has reinforced my strong and unequivocal support of the Patient Safety Act. So I wish I had the words to get us to find the political will to do the right thing. Enough testimony, do it.
It's 20 seconds till the last call. Go ahead. I lie now, you know it's easy. I like when it all is on the low. And I'll be anything you ask and more. Go ahead. It's not a miracle we need it. And no, I wouldn't let you think so. Hold it, hold it, hold it, hold it.
Massachusetts Nurses Association is demanding transparency from hospitals regarding offshore bank accounts.
If you are putting your money in the Cayman Islands, we have a right to know why and how much you're putting there.
This fact pattern is here to symbolize the outrageous, exorbitant compensation packages that hospital CEOs are receiving while hoarding funds offshore and overseeing the callous cutting of healthcare services for our communities in need of these services.
Massachusetts hospitals make over half of their money from taxpayers. They stash millions in offshore Cayman Island accounts, while their CEOs make millions. These prestigious hospitals made over $1 billion in profits, while smaller hospitals serving poorer patients are closing. Tell your legislator to shed some light on how hospital CEOs spend our tax dollars.
Fighting to keep a major hospital in Berkshire County open are making a last-minute appeal to Massachusetts Governor Deval Patrick.
The governor has the ability to declare a public health emergency. There are funds in the distressed hospital fund that could be used to bridge the gap.
People in this Commonwealth deserve to have care when they need it. To take it away from them, especially in a critical area like this, it's not right.
Tonight's top story, the medical emergency that is turning into a court battle.
North Adams residents await health care restoration and a bankruptcy resolution.
The governor and the administration should know that the residents of North Berkshire and the 1st Berkshire District are concerned. They want to see a favorable resolution.
For a packed meeting of concerned North Adams residents, the Massachusetts Nurses Association released new data Tuesday about North Adams Regional Hospital's finances. This report indicates a hospital can be sustainable in North Adams.
It is viable, it's viable fiscally, and it's certainly necessary for the health of the community.
Nurses from across Massachusetts rallied outside of the State House. They told 22 News they have way too many patients than they can handle.
In the last 5-6 years, it's gone absolutely downhill. We don't have enough people to take care of the patients. We don't have enough nurses. If one nurse calls in on a shift in the whole building, we're crippled.
Nearly 8 in 10 registered nurses report that the quality of patient care in Massachusetts hospitals is deteriorating, and by more than a 2-to-1 margin. Not only are we in a position where we feel our patients are unsafe, we can't even begin to give them the care that we know they need and deserve. The time to act is now. This issue of safe patient staffing by registered nurses in this decade has moved from imperative to critical, and now it's a crisis. Thank you.
The House on Wednesday unanimously signed off on a bill that sets nurse staffing ratios in intensive care units within hospitals. Now, it still has to pass the Senate and be signed into law by Governor Patrick.
As far as patient safety and limits, I believe that he really should sign this into law. If he does so, it would be a landmark decision. It would be something that we worked for, and this would establish in law that there needs to be limits on the number of patients that can safely be cared for.
In the past 6 months, UMass Memorial Medical Center has drastically reduced its workforce. 285 jobs were cut in October. Today, news of another 103 full-time positions eliminated. The MNA fears more cuts in the future.
We are here today with other members of the embattled system to appeal to our CEO to heed our warnings and to work with us, not against us.
With all the bad news, here's some good news. To ensure your safety, a new law says intensive care unit nurses can now only care for 1 patient or 2 when it's safe. Ask how many patients your nurse is caring for today. But outside the ICU, there is still no maximum legal limit, and nurses are assigned too many patients. The Massachusetts Nurses Association will keep working until there are safe limits for every patient in every hospital.